Hello everyone and welcome back to Medi Notes on Medicos. The topic that we're going to deal today is about type 1 hypersensitivity from microbiology. The main objectives are introduction, mechanism, the signs and symptoms, the detection and the treatment of type 1 hypersensitivity. So let's dive into the topic. So type 1 hypersensitivity is one of immunological reactions which occurs rapidly, that is within few minutes or even seconds of exposure to the antigen. So this is also known as anaphylactic hypersensitivity, and it is mediated by IgE antibodies. It involves the degranulation of mast cells or basophils. So they occur in two forms. They can either be anaphylaxis or they can cause atopy. So the mechanism might look complex over here, but it is a very interesting and very easy mechanism. That is, when the first exposure occurs, what happens is the APC processes antigen and it presents to the Th2 cells. Now the Th2 cells, they release interleukotriene 4 and interleukotriene 13, which activates the B cell. Now this B cell, they proliferate and differentiate into plasma cells that synthesize and secretes IgE bodies. It is this plasma cells they form, that forms the IgE bodies. Now these IgE bodies, they combine to the Fc region of the mast cells and cause a sensitization. And when it causes a sensitization, on subsequent exposure, that is if there is a re-exposure to the allergens, the mast cells along with the IgE bodies, they bind with the antigen, releases the inflammatory molecules, that is the histamines, leukotrienes, other mediators, and they result in allergy symptoms. Next is the signs and symptoms. So it can cause anaphylactic shock like seen in this picture. That is, what happens is itching of scalp and tongue, flushing of skin, difficulty in breathing, nausea, vomiting, abdominal pain, diarrhea, sometimes blood in stools, and other changes like edema seen in this picture. Decreased coagulability of blood, leukopenia, decreased blood pressure, decreased temperature, thrombocytopenia, acute hypotension, loss of consciousness, and sometimes even death. So what is the detection method? We can do skin test. Skin test is a method in which we use a small amount of suspected allergens and we introduce this in the patient or in the patient that comes to the OPD by intradermal injection or superficial scratching. So what happens is a wheal and flare formation occurs due to this. And prior to after 30 minutes of the administration or within 30 minutes, and this confirms the allergy. There is another test known as radioallergosorbent test, that is RAST. Here the total levels of serum Ig can be determined, and this can also can be estimated in serum using fluorescent labeled anti-IgE by the ELISA method. The other method is radioimmunosorbent. Here the estimated total circulating Ig antibodies is done. Next is the treatment. So there are two types. One is acute anaphylaxis or allergy treatment. We can give the patient epinephrine, that is also the other name for adrenaline. We can give antihistamines that block H1 and H2 receptors, and corticosteroids that decrease the histamine levels in the body. For atopic persons, we can treat it by desensitization. So that was the topic for today. I hope you like this topic. If you like this topic, don't forget to like, share and subscribe to the channel. We'll be coming with more videos in the future. So stay tuned and happy learning. This is Ashnavi Raja signing off for today. Bye.